Hello, how are you all doing? Great? Mummy, have you just started on solid food and my teeth have started popping up? I am showing some diarrhea. I am quite irritable. What I am doing? Yes, going through this solid starts and teething phase is a very tough job, isn't it, Mom? But to make your journey simpler and to clear some concepts about how to maintain oral hygiene from 6 months to 18 months toddlers, I am here to help you out. So come, let us have a look at this today's video.
Subscribe to my channel Dr. Mansi Shah for dental care tips.
Hello and a very happy morning to all of you. And here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. Friends, now the baby has reached a greater milestone of 6 months. It might have started crawling, some have started standing up, some have started babbling, and now comes the greater stage and the mom is ready to start the semi-solid solid foods. Now as soon as you start with the solids, you can see the baby has also started with this teething phase where the first small teeth starts popping up and your baby is a little irritable. It's okay. This teething phase is going to pass out. If you want to know how to handle or deal with this teething phase, here is the link. Make sure you watch the video and try to soothe your babies into this a little tough phase for them. So friends, today we are going to discuss on a very important topic, that is of maintaining oral hygiene. How to start introducing oral hygiene in your this babies. Now there is a restriction according to WHO, American Pediatric Dentist also, that there has to be no salt and sugar at least till 1 year of age in your baby's food. So no sugar means no sugar. It is not that, oh, today I give a small piece of cake. It's okay. I'm just giving a taste, but otherwise I don't put up a sugar. Today I just make him taste some biscuits. Oh, it's okay. I'm not putting sugar. Friends, we all love to eat sweets. Who does not? Now, once you start introducing this kind of sweet things to your babies, their preference, their priorities turn towards the sweet things. So make sure whenever you're giving something to your baby, it is not having sweets at least till 12 months of age. Post that, you can slowly start introducing them. Now, once at 6 months, if you are seeing that there is some teething that is started up, or rather without teething started up, also I have recommended that you have to take a clean gauze piece or wet cloth and clean up the baby's teeth. At the 6 months of age, you have started noticing small white teeth that have come up from your lower jaw, that is below the tongue. Sometimes they are not quite noticeable. They start being noticeable at the age of 8 months. Till the time you start properly noticing them, as I have recommended earlier in my videos also, you clean baby's gums and clean the tongue. Why is it important? I have been mentioning it for appropriate oral hygiene. This is required. Now, you take a clean gauze piece, clean properly all the gums. Now this has to be included in your bedtime routine. Once you start noticing small teeth, you make sure that in your bedtime, nighttime routine, you start introducing brushing, maintaining of good oral health. So now, by this 6-7 months of age, you are quite well known with what pattern or what are the timings of your babies when he feeds, when he or she feeds, and when they go to sleep, right? So now you have decided, suppose approx my baby sleeps at 10:30 in the night. I know that I start my bedtime routine at around 9:30, 9:45. So that's the feeding time when I take the baby to feed. Post that, I give some good massage, all the night routine is done, read storybooks. Now, if you know that the baby is not going to feed again, you take him to the bathroom, show him or her the mirror and say, dear, you have got 2 little teeth. Now we are supposed to clean them up. Just if you are just into that initial stage, that around 8 months, where only the lower teeth have been erupted, still till that age also the wet cloth and the gauze piece would work. Just make sure that the gauze or the wet cloth that you're using is properly clean, sterile. Please do not reuse yesterday's cloth today because it is going to have n number of germs. It is better not doing it if you're using the stale cloth or the stale gauze piece. So make sure that it is clean, sterile and fresh. So once you take that, dip it into some warm water, clean it. The teeth which have been erupted, you scrub them a little so that there is no plaque formation or there is no sticky material that has been there on the tooth. Now, once you have started getting the upper teeth, that is around 8 to 9 months of age, you start introducing a finger brush. So as shown in the picture, you get this fingertips brush anywhere in the medical store and also online. So use them. Also make sure that the bristles of this brush are very soft, because you're buying some cheap finger toothbrush which has hard bristles. It is going to do more harm to your baby's gums because they have very small teeth, right? So make sure the bristles are very soft. So you take that finger or brush, clean it properly. Now the cleaning has to be in rotation motion. So it is round for lower. Now for the upper fronts, you have to give an up-down motion so that nothing in the front portion, nothing in the back portion gets accumulated. The remaining portion has to be yet cleaned with a wet cloth or a gauze piece. Now, once the baby starts getting all the teeth slowly, that will be around 12 to 14 months of age, all the primary, the milk teeth have been erupted. Okay. So these teeth are not 32 in number, they are just 20. 5 on right, 5 on left, upper. 5 on right, 5 on left, lower. So this way, you are going to have 20 sets of milk teeth. This milk teeth are going to fall off, and then 28 sets of teeth and 4 wisdom. So equal to 32 teeth are going to come up. That process is going to start at 6 years of age. So 6 months you start getting your primaries, that is up to 12 months of age they'll come. 6 years of age, this primary or milk teeth start falling off, and the next set, the permanent set, starts coming up. Now this set of milk teeth has to be properly maintained. As I said, with finger brushing, once the molars have erupted, that is, your baby is able to hold a brush, grasp it properly, clean it properly, that is around 12 months to 13 months of age, that time you are going to brush first and then train your baby to hold the brush and just move it so that they enjoy that brushing process. So at this 12 to 13 months of age, a brush has to be introduced. Till that time, your baby also understands what is rinsing. So you teach your baby how to rinse. If you're not satisfied, you can still use the wet cloth and the gauze paste method to clean off the residue or the material. If you're using a toothpaste, then clean that off. So this is how brushing or oral hygiene has to be introduced step by step. Just like step by step food, step by step potty susu training, brushing, maintaining good oral hygiene, having a great bedtime routine is very much important, and that also has to be introduced step by step. Now, if you yourself start doing it with your babies, nothing like it, because they follow what you do. So once they start brushing along well at around 18 months, make sure you grasp your brush, you give them yours, start brushing. Also, not to forget, before their first birthday, or let us mark first birthday as a dental visit day. Yes, you should definitely visit your dentist before his or her first birthday, because that's the way how you will reduce their fear of dentist and have a greater and good oral hygiene. If there is anything that is required, your dentist will definitely tell you. Friends, hi, I am Dr. Mansi Shah, a practicing dentist in the city of Pune. If you have any questions related to oral hygiene, to brushing techniques, or anything related to pediatric dentistry or adult dentistry also, then make sure you are mentioning it in the comment section below. Ask me and I am here to answer all your queries. Make sure that you visit your dentist in every 6 months and take your babies along, because they are going to enjoy that visit. I am sure that is going to give them a very happy and a healthy smile. If you are liking my videos, then make sure you like, comment, share it along with your friends, and do not forget to subscribe to my channel Dr. Mansi Shah. Friends, please, if you are loving my videos, make sure you subscribe, because every time I post a video, you should be notified about it. Wishing you all a very happy and a healthy smile. Stay healthy, stay happy, and stay over fit. Thank you.